everyone, it's Lucy and welcome back to another video. I chose to do a week in the life type vlog for this month's content specifically because for the past 2 months I have been really struggling with some insurance coverage problems and some claims going on, and it has been kind of consuming my life. And I want to really shed light on that in my work with the CCYAN and show that a big part of having a chronic illness is all of the financial burdens and time taken up by medical expenses, insurance, bills, etc., and not just the physical effects of the disease itself. It's been a very stressful couple of months dealing with some billing errors and insurance claims, and it has not only been taking a toll on my stress and mental health, but also on my family's as well, as they've been trying to help me through this. And I really want to show the world what it means to be a person with a disability and to have a chronic illness, and how much more it entails than you might think. It really impacts every single aspect of our life. And while I have a full-time 40-hour-a-week job and do volunteer work, I am also trying to deal with insurance claims, making sure I get my medications refilled, making sure I get lab work done, phone calls with clinics, labs, insurance companies, etc., and trying to balance that with keeping myself healthy and well. And so the past couple of weeks have been really overwhelming, and I think that that's important to share, and so that's what I'm going to be sharing this week. The main things that you will see me doing in this video are going to the drive-in pharmacy to pick up prescriptions because we're in the middle of a pandemic and we cannot be going into pharmacies at this time. I will also be showing what it looks like to get lab work done in a hospital during a pandemic and what kind of procedures go on there. And I will also be talking about my experiences, frustrations, failures, and successes with trying to get medications on time. So the first clip that you will see of me is going through the drive-in pharmacy to attempt to pick up some medications, and you'll see what goes on from there. So right now I am waiting in line at my pharmacy drive-thru, trying to get some of my prescriptions refilled, and you have to wear a mask, and thankfully the pharmacy that I go to has a drive-thru option, which I normally do anyway because as an immunocompromised person I don't like to go into pharmacies even not during a pandemic, but because we're in a pandemic, a lot of other people are choosing to go through the drive-thru right now as well. And so the line is really long and it's really hot. So I'm just sitting here waiting to get my prescription filled, and I will be back once I get past this line. Okay, so this is Lucy from a few days later, and I'm going to try to go back to the pharmacy because I was not able to get my prescription at that time because of some insurance difficulties that hopefully are worked out now. I'll spare you the details of this particular situation, but basically insurance can be a really big obstacle for people that have chronic illnesses because every time there's a problem with our insurance or with billing, it can inhibit our ability to get our medications on time, which is really important for our health. I've been dealing with some insurance and billing obstacles for about 1.5 to 2 months now, and hopefully it has become resolved, and so I am about to go to the pharmacy again to see if I can get my medication. Okay, so I got up to the pharmacy window and they said that it's going to take 30 minutes for them to get my prescription ready. I don't know why that is the case because I placed this order a couple of weeks ago, and I was under the impression that all I needed was to get some insurance stuff figured out in order to get this prescription filled, because when I showed up last week in the last clip where I was wearing the red shirt, the medication was ready. They just couldn't give it to me because of an insurance problem. And so now that I'm back and the insurance problem is fixed, I don't know why it's taking 30 minutes to fill the prescription that was already filled. So I am kind of too exhausted to continue questioning things at this point, and so I am just going to sit in the parking lot for 30 minutes. It is a little bit frustrating because I'm on my lunch break, and so I have some work I need to be doing, but I don't really have many other options because I need my medication. So I'm just gonna sit here in the parking lot, try to do what I can from my phone for work, I guess. And hopefully in 30 minutes I will have my prescriptions. So crossing my fingers. I got my medication. Yes. Okay, so now because we're in a pandemic, before I even head home, I have to use my sanitizing wipes and wipe down the bottles of my medication. And then I'm going to take my bottles of medication out of my bag and put them into my purse so that I can just throw away this paper bag as soon as I get home. So I'm going to do that and then sanitize my hands, sanitize my phone, sanitize my steering wheel, and then I will be on my way home. Okay, so I just had the world's fastest doctor appointment via Zoom. It was not even 15 minutes long. I think it was 10 to 15 minutes long with my primary care provider. Because I have a tic disorder and I needed to talk to him about that and get some referrals done. So not IBD related, but disability and health related. And I thought I would include that in this video because of the pandemic, I can't go in to the doctor's office. I really shouldn't go into the doctor's office unless it's absolutely necessary. And so I chose to do a Zoom check-in with my primary care provider, and if he really felt like it was necessary for me to go in, then I would, but I didn't want to do that unless I had to. So I had gotten off of work and immediately had a Zoom call with my primary care provider, and now I have about 2 hours before my Zoom therapy session. So it is a very busy day, basically working all day and then 2 doctor's appointments back to back, but I'm grateful that telehealth and Zoom exist so that I am able to do that. And tomorrow I am going to be getting blood work, which I obviously do have to go into the hospital to do. And so I am going to be sharing that experience with you to the extent that I can, filming in the hospital. And you can see how it works to get lab work done during a pandemic. Hey guys, I just got off of work and now I am about to drive over to the hospital and get my blood work done. So I will check in with you once I am parked at the hospital. Okay, so I just parked at the hospital. I've got my mask on, I've got rubber gloves on, latex doctor gloves, and I am going to head into the hospital. I'm not even going to take my purse. I'm just going to put my wallet, my keys, and my phone in my pockets so that I have as little things that could be contaminated as possible. And I'm going to hopefully go get my blood work done, and then when I come back, I'm going to sanitize very well with my hand sanitizer. I'm going to throw away my gloves, and when I get home, I'm going to wash my mask, and I am going to jump in the shower so that I can be as sanitary as possible. So wish me luck. Hopefully I can get my labs done and that there's no obstacles in my way. In this clip, you can see me walking into the hospital, and when you walk into the hospital, there is an entrance door and an exit door that's kind of makeshift to make sure that you don't pass directly by one another. It's kind of all single fashion, and that's kind of the way that the whole hospital is set up. There's little markers on the floor to tell you this is only one way and this is only one way, so that there is less direct contact between people walking past each other. So the first thing that you see when you walk into the hospital is a nurse wearing a mask and a face shield, and they have a thermometer. And so the first thing they do is they ask if you've had any COVID symptoms or if you've been around anybody that has been diagnosed with COVID. I said no because I have not. And then they take your temperature, and you can kind of hear in this clip that my temperature was 96.4, which is actually low, but I run low. And so because I did not have a fever and I did not have any symptoms or know people that had symptoms, then they gave me a name tag with a date on it to show that I had been cleared to enter the hospital that day, and I was to go straight to the lab and get my lab work done, which went very well, very smoothly.
Mechanical level on the main tower is all clear.
Well, that was an eventful time at the lab because as I was seconds away from leaving, they called code red for a fire, so we had to batten down the hatches. But after a few minutes, then it was all clear and we were able to leave. And so I got into my car, I thoroughly sanitized my phone, my wallet, my keys. I took off my gloves and then sanitized my hands, and I was able to get my lab work done successfully, thank goodness. And so that means that I can get my medications refilled. And so now I am going to go home and I'm going to put my clothes in the dirty clothes. I'm going to take a shower and then I'm going to make myself some dinner. So I talked a little bit about insurance, dealing with claims and payments and bills, and I obviously cannot go into detail about that, and I cannot show me talking on the phone with my insurance companies, but I just want it to be known that sometimes in the life of someone with a chronic illness, example, me, you can spend hours and hours and hours on the phone throughout a week or throughout months just trying to get your medications on time. And I had gotten to a point where I was completely burnt out and overwhelmed. I was trying to do my full-time job, which is like a 9-to-5 weekday job, and trying to call insurance companies and pharmacies and deal with bills that have the same working hours as my job. And so I was trying to make these phone calls while working from home, and it was getting very overwhelming, and I was starting to almost panic because I felt like I wasn't going to get my medication in time. And so then thankfully my mom stepped in, and she was the real MVP, and she spent hours upon hours on the phone with my insurance companies and my specialty pharmacy to try to get everything sorted out. At this point, I kind of have to take things day by day because it is so overwhelming and there are so many layers to my problems with getting my medication and getting my bills covered. And so I almost have to look at it as a dose-by-dose situation. My medicine is in the mail right now for the dose that I'm supposed to take this weekend. And then once I get that in hand, I can worry about the next step and so on and so forth. My biologic medication was actually supposed to arrive in the mail today, but as many of you know, the west coast of the United States is on fire, and so there are delays in shipping, and so I will have to be several days late to my dose. I think the fires are worth mentioning in this video because of their impact on people with chronic illnesses and in the community in general. I live in Portland, Oregon, and our air quality index is currently hazardous, and we are not supposed to be going outside at all. This means not only are there delays in getting medications and packages, etc., but also it can have detrimental effects to your health. So I had a fever for a few days, and then I've had a sore throat for about a week. And it just takes a toll on your health and your mind and your body to be living in a pandemic, trying to get insurance sorted out, and have the fires ravaging the Pacific Northwest. All that being said, I have to thank my parents for always being there to support me and help step in when I am no longer able to deal with the burden of my illness. And I also just want to make the point of how important healthcare is and how important affordable drugs are. With everything going on in our country right now, from the pandemic to the wildfires, I believe that healthcare should be a human right, and I don't believe it should be such a burden on our mental health and well-being to have to worry about paying our bills and getting our life-saving medications amidst all of the crises that are going on worldwide. Like I said before, having a chronic illness and disability affects every aspect of your life, and it can be a lot, and it can be very overwhelming. So I want to share this experience with you to let you know that if you're going through this, you're definitely not alone. We will continue to advocate for you and share our experiences to make sure that nobody feels alone and to make sure that we are all working together collectively for a better future for those with chronic illnesses and disabilities. I hope that this video was able to give you a window into the life of somebody with a chronic illness. And if you have a chronic illness, I hope that this video was able to help you feel less alone and know that people like us are standing with you and advocating with you. Having a chronic illness can be tough, but we can be tougher. Have a good rest of the month and stay safe, everyone.